The fact that we can get people feeling better and back to living the regular normal lives in such a short period of time is what really separates structural heart disease from a lot of other fields. All heart valve disease is structural heart disease, but structural heart disease also involves more than just the valve. They may involve deficits in the walls of the chambers of the heart or connections that arise out of the heart or come back to the heart. The most predominant symptom is heart failure or shortness of breath, increasing shortness of breath. At Rush, we have a multidisciplinary team that involves interventional cardiologists, heart failure cardiologists, electrophysiologists, and surgeons that come together to decide what is the best way of treating a particular patient. Once that's identified, we have registered nurses who are our valve coordinators that walk the patient through the entire process, starting from testing to blood work to the procedure and after.
When we see a patient for consultation, we don't have to repeat studies. We have information to be able to tell them right at their first visit. So that's one part of the team. It's kind of like the concierge. They set things up. And then I feel like Diane Weldon and I, who are the valve clinic coordinators, are nurses who help navigate the patients through the process. That's the best part of the job, is working with the patients, and I really like to be kind of the face of the program and introduce them, because I do know it's scary coming in, and I do feel that I have a lot of background and can provide them information in a less intimidating way sometimes.
We also get referrals. They refer the most complex of those cases to us because we have the resources to do them. In addition to the aortic valve, we also treat the mitral, tricuspid, and the pulmonic valve. We do both repair of these valves, but as a large academic center, we also have access to clinical trials that enables us to replace these valves through catheter-based approaches, which not too many hospitals nationwide have the ability to do.
TAV refers to a procedure that we perform. It stands for transcatheter aortic valve replacement, innovative technique where we can replace the aortic valve using minimally invasive catheter-based technology, where we can go through the small incision through the femoral artery, and we implant a new valve inside the older aortic valve. This procedure takes about an hour. We do it while the heart is beating. The main benefit of this procedure is the fast recovery. The original problem of Carson was he suffered from a bicuspid aortic valve that had early deterioration in its function. He underwent 2 surgical aortic valve replacements in the past. And again, the valve degenerated and led for him to go into heart failure. And at that point, we performed the TAVR procedure to replace his surgical aortic valve.
And I just recovered just remarkably fast and was back walking a mile, I would say, within 4 weeks.
What I love most about what I do is being able to benefit patients and provide them with a deep, meaningful impact that may affect the quality of their life.
And I'm looking forward to traveling again. I've always been a big traveler. I like to go overseas. I've said this many times about Rush. There's this culture of calm. And, when people come into your room late at night to take blood, which, I've had 2 open hearts, I know what that's like. You have these nurses that are so kind and so aware. It's just life-changing. That how can people be so giving and kind? It's an amazing thing. I look at the profession totally differently now after coming to Rush.